So the first question I'd like to ask is if you could each just tell us what you've been doing for the last 10 years, and just a little bit about yourself so we could all hear you speak and get to know you. So Karla, why don't you go first, then Cyrus, then Scott.
Happy to. Thanks. So, Karla Mans Giroux, I am a metastatic breast cancer thriver myself. So, for the past 10 years, I have been overcoming that diagnosis and turning it into a chronic disease that I plan to manage for the rest of my long, healthy life. I've always had a goal to live to be 101, healthy and sane, and I intend to get there. And utilizing the radical remission healing factors and the best of conventional medicine, taking an integrative approach has really helped me a lot. So I became a national board certified health and wellness coach about 5, 6 years ago and became a certified radical remission coach directly after that. And when my corporate job decided to move from the Chicago area to Boston, I was able to take a nice big fat severance package and start my health coaching business. And it gives me great pleasure to help other people who are trying to overcome a diagnosis from cancer. And working with Dr. Turner, we continue to share the research that she found. Her book, Radical Remission, was published 10 years ago this year, and we're celebrating the 10th anniversary. We started a podcast called Stories That Heal, and we're sharing inspiring stories of others who are overcoming a dire prognosis, as well as stories from the practitioners that are helping them to achieve that remission.
Thank you.
So exactly 10 years ago was 2014. And that's when I had left my job in biotech. So I was working, I had graduated with a PhD in nutritional biochemistry. And then for 2 years, I went to go work in biotech, thinking that that was a good place for me to use my skills. And while I was there, I realized that all I did was sit in front of a computer looking at Excel spreadsheets, and I wasn't really adding any value to humanity. So I decided to start a coaching program where I could actually work with people who were living with all forms of diabetes, type 1, 1.5, prediabetes, type 2, and gestational diabetes, and teach them the truth about what actually causes their blood glucose to do strange things. So the coaching program I began building back in 2014 was called Mastering Diabetes. And then I joined forces with a good friend of mine named Robbie Barbero. The two of us both have type 1 diabetes. And over the course of the last 7 to 10 years, we have built a coaching program that teaches people how to transition to a plant-based diet and how to use that as their primary tool for reversing, not just managing, but reversing insulin resistance, which is the underlying cause of high blood glucose. It's been a fun ride. We've helped tens of thousands of people. And as far as we're concerned, we're only getting started.
Thank you.
Yeah, and thank you, Steve. It's great to be here and join the conference this year. And just very briefly, my journey, like Cyrus, mine started 2003 when I noticed that my patients were all telling me they were falling apart. I was trained like every other healthcare professional in a traditional allopathic program, and I thought falling apart was just the inevitable consequence of aging. What I came to realize is that what my patients were actually describing is that they were losing quality of life, relational challenges, financial impact. The joy of life was being eroded by their diseases. And so one day a woman asked me for help, and I realized that I had not been trained to actually help her reverse disease and restore quality of life. So I went on a personal learning journey that took me into lifestyle medicine and whole food plant-based nutrition, and started using my prescription pad for breakfast, lunch, and dinner, and saw radical transformations, not only in my patients, but also in my staff as they started to see patients reversing disease and made changes themselves. Recognizing that it took a long time for me to learn, we started a conference in 2013 with my partners Tom Dunham and Susan Benegas. And we launched the International Plant-Based Nutrition Healthcare Conference to educate healthcare professionals, which we've been doing now consistently since 2013, as well as helping to start organizations and conferences around the world. We have a journal, International Journal of Disease Reversal and Prevention, which is the only journal dedicated to documenting the science of disease reversal. So just delighted to be here, and I want to appreciate you for tackling a 17-day live online conference to get all of this information out. So thank you.
Thank you. So Oprah Winfrey wrote a book once called What I Know for Sure. So before you answer difficult questions and try to compare chlorella with spirulina, what is the things you would bet anything on that you know for sure? Even though it's not as long a list as the things you probably are sure of, what can we absolutely be certain of from your years of experience are 100% absolute that you know for sure that we could start with as a base? One, Karla, and then Cyrus, and then Scott.
Right. What I know for sure is that we are powerful beyond belief, that we do not give ourselves enough credit and do not believe in ourselves enough, but that we are capable of overcoming a lot of challenges. And what I know for sure from the radical remission research is that we can reverse disease, we can overcome disease by utilizing lifestyle practices. And it's not only about the physical, but it's also about the emotional, mental, and spiritual as well.
Thank you.
Great response. Great response. There's a lot of different lifestyles that you can learn about on the internet today. There's a plant-based lifestyle, a ketogenic lifestyle, low carb lifestyle, and it can get very confusing on the internet. Over the course of the last 20 years, having transitioned to a plant-based lifestyle, I have learned one thing that every single health professional, I think, would all agree upon, which is reducing your intake of processed food and ultra processed food is something that everybody can get on the same page about, regardless of the actual diet that you are prescribing for your patients. Reducing your intake of processed food will, without question, make you a healthier individual. And that is a very solid foundation upon which you can add multiple other lifestyle practices to make yourself even healthier.
Thank you.
Yeah, I'm glad that you all didn't take away all the answers by the time it got to me. Thanks for leaving some on the table. Yeah, I would say a couple of things, kind of echoing what Karla did, that, the power of hope and a future vision are essential for living a long, healthy life. And we can help reestablish those things in healthcare to give people a greater vision that they do have the power to control their future far more than they may recognize by simply stepping into those basic things that everybody's aware of: good night's sleep, moving every single day in many ways, eating more plants, and stressing less and loving more. Those are the core essentials that I think we can all agree upon.
Thank you. So, Karla, one question that would be of tremendous interest is, we're aware that there's been miraculous things that have happened from the radical remission book and all the research you've done. But the question that would really be the most interesting is, what % of people who follow this can actually recover? Are we just saying, look, there's 1,000 people out of 1,000,000, because that's just, 0.1%, and suddenly this is less exciting? If it's 1,000 people out of 2,000 that follow this and got better, then that's unbelievably exciting. So do we know how rare or how not rare it is to recover following all the steps that you're aware of?
So unfortunately, no, we don't know that. We don't track that. And the Radical Remission Project does not guarantee that following these 10 lifestyle factors are going to cure you or put you in remission. And the research has been done on people that did overcome a dire prognosis, but we're not continuing to research people that go through our workshop and coaching. All that said, we will have a very exciting publication coming out later this year. Well, we'll have a journal article that'll come out that says the workshop does make a difference for people. And so we had about 250 people in a pilot study at Harvard who went through the workshop. They took a survey before and then 1 month after and 6 months after that workshop. And what the results showed was that it was a significant improvement in people's quality of life after having attended that workshop. And those results held fast for 6 months. So once that journal article comes out, we hope to actually be able to do additional studies, maybe a trial, to actually start to collect more data on people that are following these 10 healing lifestyle factors.
Thank you. Cyrus, I've read your book. I've actually looked very closely at it because I found the subject matter very interesting, diabetes and blood sugar. Um, it seems that you're very clearly saying, you can rephrase this if I'm not saying it right, that fat is interfering with our body to process the sugar or something along those lines. But what are you exactly saying about plant fat, avocados, olives, raw seeds, raw nuts? Are we trying to keep this amount down, or is this not an issue? It's only fat from animal products.
Very good question. So you're right. If we go back to the basics, the premise of the Mastering Diabetes book and the Mastering Diabetes platform in general is that eating dietary fatty acid interferes with insulin signaling. And this is not a theory that came from me. This has been research that dates back to the 1920s and has been proven over and over and over again in different contexts with different species in, in small rodents, in monkeys, and in human beings. Now, the simplest way to put it is that dietary fatty acid, regardless of the type of fatty acid that it is, whether it's saturated fat or unsaturated fat, interferes with insulin signaling inside of the liver and inside of the muscle. And that's something that I think the diabetes world just doesn't really have a full grasp on. So your question is, okay, fine. If you're consuming foods that come from the animal-based world, are those going to be different than consuming foods from the plant-based world, whether it's nuts, seeds, avocados, or oils? And the answer is yes, they definitely do behave slightly differently. The truth is that saturated fat, so foods that contain a significant amount of saturated fat, which tend to come mainly from the animal-based world, whether it's white meat, red meat, chicken, fish, dairy products in particular, those foods tend to have the most insulin resistance inducing effect. In other words, saturated fat is the single nutrient inside of the human diet which has the strongest ability to create the insulin resistance pathology. Unsaturated fatty acids, which are fatty acids that have at least one carbon-carbon double bond in them, or sometimes multiple carbon-carbon double bonds, they behave differently. So if you're eating an avocado, as an example, the avocado does contain some saturated fat, but it also contains a significant amount of unsaturated fat. Is that going to have the same effect as having white meat or red meat or chicken or fish? The answer is no. It's going to be a little bit less powerful at inducing insulin resistance. However, what we have determined empirically and working with a lot of people is that the total amount of fat that you consume matters. So the total amount of fat is the number one most powerful tool that you have at your disposal to try and limit how much insulin resistance develops in your body, in your liver and muscle. But secondarily, the type of fat that you consume is actually the most important. So to answer your question, Steve, in a nutshell, what we teach people to do is, as a generality, try and keep your total fat concentration between about 30 to 40 grams per day. That's sort of step number one. And if you can bring your fat concentration down to about that level, and then simultaneously try and gravitate towards as much unsaturated fat as possible from plant-based foods, you're going to be doing yourself a significant favor. Does that answer your question?
Yes, but if someone is saying, I'm still not getting my blood sugar down, is one of the main levers to then reduce their plant fat?
Correct. That's exactly right. So we've been sort of told over and over again, you've probably seen this on the internet yourself, where people say avocados are good for you because they contain healthy fats, and nuts and seeds are good, and coconut is good because they contain healthy fat, right? And there's a certain validity to those statements. There's no question about it. But the term healthy fat, I think, is just thrown around too loosely. And people get this idea that regardless of what vegetable they're consuming or what fruit they're consuming, if it contains a lot of fat, that's okay because it comes from the plant world and it's quote unquote healthy, right? And again, there's validity to that because it's going to be a better source than if you were to eat from the animal-based world in general. However, too much fat is too much fat. So long story short, yes, keep your fat intake as low as possible. Try and get it to about 30 grams of fat per day if you're specifically trying to regulate your blood glucose, and you'll see some very powerful things happen in a short period of time.
Thank you. Dr. Stoll, so there's a lot of medical doctors that don't preach or advise their patients to have a whole food plant-based diet. So why do you? What studies have you seen? What's influenced you? What's made you come to the conclusion that a whole food plant-based diet has a benefit that you would recommend to your patients, where most doctors are still not recommending that?
Yeah, there's a famous quote from Maya Angelou that said, she says, "I did then what I knew how to do, but now that I know better, I do better." Mm-hmm. And for most of us, in medical school, we receive 19 hours of nutritional education. None of that is the nutrition of disease prevention, suspension, or reversal. It's largely hospital-based nutrition. And so we really don't know. We don't know the science. We don't know the evidence. The specific studies are growing in number. And, early on, there were the studies of Dean Ornish, Caldwell Esselstyn. There's a large study in Iran looking at reversal of heart disease, had the same conclusions as Dr. Dean Ornish. We have, interesting studies looking at disease reversal from several different angles, looking at diabetes reversal. Very nice study that compared a vegetarian diet to the American Diabetes Association diet. And it was interesting because they not only compared the medication reduction, insulin levels, but they also compared some very important markers looking at the body's antioxidant capacity and anti-inflammatory levels. And they found not only was the vegetarian diet superior, but when they compared the diet at a more cellular level, the American diabetes diet did not impact in a positive way at all those antioxidant measures. But the whole food plant-based diet not only had a superior reduction in medications, improvements in blood sugar, but dramatically changed the cellular level as well. And that kind of just stepping out and looking more globally at some studies, when we look at large meta-analyses, we find that in probably 3 different studies in the last 5 years, they've recommended 10 servings for 800 grams of plants as the optimal way to prevent, suspend, and reverse disease. And they found that it's a dose response. So every single serving you add has benefit. And I think that's really encouraging that, there is benefit in adding a single serving of plants every day. You can start and move along that spectrum. The longest lived and greatest weight reduction of any study came out of New Zealand, where they simply recommended a plant-based diet, did not intervene with any exercise, and found that people were able to sustain and lose weight on a plant-based diet for a number of reasons. We also have studies showing that not only, as Cyrus is talking about this, and I'll let him talk about it more later, can you improve your blood sugar levels, reduce insulin resistance, but with the right diet, and if you have beta cell function, the cells that produce insulin, can improve the function and sometimes improve the numbers of active functioning beta cells in the pancreas that produce insulin. And I'll just end with one study that I think is so impactful because it's a condition that's very difficult to treat. It's diabetic neuropathy, which is painful nerve pain in the legs, secondary to the tiny blood vessels being injured by high blood sugar levels. And it causes severe pain in the feet. Sometimes you can't even put a sheet on your feet, and medicine does not have a good solution for that. They use neuropathic medications. They cause weight gain, fatigue, and a host of other problems. They found when they transitioned people to a very intense interventional whole food plant-based diet, the diabetic neuropathy was reversed in as little as 2 weeks. And so this is really good news for people that have severe pain, that they can suffer from this condition for years, but with just 2 weeks of the right diet, they could actually step in and be pain-free. And there's more we can talk about, but I'll stop there.
Thank you. Karla, can you tell us what are the 9 key factors that Kelly wrote about in her books as the common themes that all the people who are beating cancer were doing?
Yes, I would love to. And in fact, there is a 10th factor that got added later and was written about in the follow-up book called Radical Hope. I'll start there. That 10th factor is exercise. So when Dr. Turner did her research, many of those cancer survivors she was talking to had been through medical treatment and were sent home on hospice. The medical community had nothing more they could do for them. And so those people were too weak to exercise. So later, Dr. Turner wondered why, because there's so much additional research that tells us that exercise is good to prevent a diagnosis, to get through the treatment, and to prevent a recurrence. So she looked back at her research. She went back through some of the interviews. She talked to some more people. And what she realized is that all of those survivors initially were moving their bodies as much as they could when they could, but they weren't doing exercise in the traditional sense of the word. They weren't running marathons anymore, lifting weights in the gym, that kind of thing, but they were moving. And so we have to reframe exercise to be physical activity. So physical activity is what makes a big difference. The other two physical factors, so of the 10, there are 3 physical factors. The other 2 are diet, so changing your diet. And there is no one single diet that came out of this research. And then the third is herbs and supplements. And that's the one factor that we recommend everyone find a licensed practitioner to help them determine what herbs and supplements is going to do the most to help them through their diagnosis. And then the other factors are emotional, mental, and spiritual. So we have empowerment. When you're taking charge of your health, you become the CEO, essentially, of your health, and you treat your medical practitioners and healers and acupuncturists and whoever you might have on the team as the experts in their field of expertise, but not as an expert on you. Then there's intuition. So going within, taking the time to be quiet and listen to that still small voice inside of you that's connected to a higher power that helps you determine what's the right thing for you to do, what's the right decision. And there is also emotional things like increasing our positive emotions. The more love, laughter, joy, and happiness we have in our life, the more our immune system is being boosted by those happy hormones that get released. So it is talked about as a muscle that needs a workout on a daily basis. And then there's also releasing suppressed emotions. So in this factor, all of the survivors that Dr. Turner talked to indicated that they had to release negativity or release trauma or release some negative low vibration emotions in their lives so that they could clear those blockages. And it's about stress and fear and forgiveness, all of that sort of thing. There's also a piece of it that was most surprising to Dr. Turner was the nostalgic piece of it. So those people who didn't come forward in their lives, those people that were living in the past, they were nostalgic, not just fond, happy memories, but they were living in the past. So think about the captain of the football team. The glory days are back in high school when he was the captain and things were going great, right? And if he's now a 40-year-old man and he's not as happy with his life, he might still be living back there in the past, wishing that he could still be the captain of the football team. Or perhaps there's a prima ballerina that can no longer dance. And, it's about living in the past and not living in the present moment. So that's another piece of releasing. We also have social support. So asking for and receiving love and support is really important. And it's a very different skill than giving. Most of us are really good at giving support, but we're probably really bad at asking for it because we feel like if we ask for help, that's a sign of weakness. And in fact, it is just the opposite. The best thing that you can do for yourself and the bravest thing you can do for yourself is ask for help. And social support, we know that loneliness is a horrible thing. We've learned since the pandemic how much loneliness can affect us and our health. So having the right social support is really important on a healing journey. And then we have spirituality. So all of the radical remission survivors deepened their spiritual practice, whether they were religious or not. It's you can be spiritual and religious, or you can be religious and not spiritual. It doesn't matter. You need a connection with something bigger than yourself. Having that connection to a higher power makes a big difference in your ability to maintain your hope and your faith and your belief that you can get well and that there's good reasons to do so. And I think the 10th one, I think I got them all. Strong reasons for living. Strong reasons for living is about having meaning and purpose in our lives. And for some of us, it's an automatic, well, I have my kids, and then I'm going to have grandkids. And then, I've got all their milestones to look forward to. Not everybody has kids. And our strong reasons for living will change over time as our kids grow and become adults, and they don't need us quite as much. While they'll always be our kids, we might have different strong reasons for living. There may be a creative endeavor that you want to write that book or paint that painting. You may find a lot of meaning and purpose from the volunteer work that you do. Your career can certainly bring a lot of meaning and purpose. You just got to be careful when you retire that you have something else that's going to really fill that need for you. So the strong reasons for living, it really gives us something to not only fight off death, but really to have a zest for living, which is really important when you're trying to overcome a diagnosis.
Thank you.
Yes.
Cyrus, let me give you my list to see if I could be a mastering diabetes coach and tell me what I'm leaving off, okay?
I love it.
We want to avoid fats and oils, especially from animal products. We want to avoid processed food. We want to not eat late, maybe stop eating after dinner. We want to get enough exercise, and we don't want to eat too much in general. What else is a lever if someone is trying to get their situation, their fasting blood sugar and type 2 diabetes under control?
I mean, Steve, you're hired as far as I'm concerned. I don't know if anybody else here objects, but you got it. You hit it on the head. So we like to categorize things into three main pillars. Number one is adopting a plant-based diet, just like you suggested. Number two, sorry, let me back up here. A plant-based diet that has three characteristics associated with it. Number one, low in fat, like we had just talked about. Number two, plant-based. And then number three, whole food. Okay. There's a lot of people that migrate over to eating a plant-based diet, and then they go to the freezer section and they get the burritos and the cheeses and the soy crackers. And that's okay. That's a step in the right direction towards minimizing your animal product intake. But really what we're trying to teach people how to do is eat a low fat, plant-based whole food diet. So if you can execute all three of those and eat as much whole food as possible while limiting your fat intake, that's the path to maximizing your insulin sensitivity, specifically when it just comes to your diet. So that's number one. Number two, movement. Just like Scott had said, just like you had referenced as well, which is moving your body on a daily basis. Our general recommendation is to move your body for a minimum of 30 minutes per day, somewhere between 30 and 60 minutes per day. And just like Karla had also mentioned too, you can perform exercise by going to a gym or getting on a treadmill or getting on a row machine and making it a dedicated block, because that's what we do in the 21st century. Or you could do what our ancestors have done and what people have been doing for thousands of years, which is just spontaneously move your body, right? Don't use your car, but get in, walk to the grocery store, get your groceries and hold them in bags and come back. Use the stairs. Don't use the elevator, right? You can perform exercise. You can perform movement, if you will, for small periods of time. And if you do that multiple times throughout the day and scatter them as what we refer to as exercise snacks, then you can end up making significant improvements in your health. And it just seems it's a very small, simple thing to do, but it actually compounds and accumulates over the course of time, right? And then number three is intermittent fasting. Now, intermittent fasting is something that I've studied. I wrote my PhD on the benefits of calorie restriction and intermittent fasting for improved glycemic control. And what that means is that, I've done a lot of research here to try and understand what is the power of calorie restriction and intermittent fasting. And what I've learned over the course of the last 20 years is that it is an incredibly powerful tool that can help do multiple things. Number one, lower your blood glucose. That's your fasting blood glucose and your post-meal blood glucose. Lower your A1C value. It can lower your LDL cholesterol. It can lower your body weight, and it can keep it there permanently. It can actually increase your energy levels, even though you're getting less energy. And then there's significant research that has shown that in many different species, including yeast, worms, flies, mice, rodents, monkeys, and potentially even humans, that calorie restriction is the only known mechanism for lifespan extension, which is very cool. So what we do is we try and teach people, eat a low-fat, plant-based, whole food diet, move your body for at least 30 minutes per day, and then also intermittent fast when necessary or on a regular basis if possible. And the combination of the three of those things can get you three insulin sensitizing components to your lifestyle that are very powerful unto themselves. When you add all three of them together, not only does it reduce your blood glucose, but it can also have powerful metabolic effects on your cholesterol level and your blood pressure and your body weight simultaneously.
And would you add a week or 2 week water fast each year with Alan Goldhammer? Would that be something that would add a lot of value, or is that not part of your?
Yeah. So you're referencing basically the True North Health Center with Alan Goldhammer, very good friend. The answer is yes. If that doing a dedicated water fast, whether it's a 7-day or a 14-day or a 30-day water fast, is something that, doesn't necessarily apply to every single person. If I did that as an example, I would lose so much weight that I would become significantly underweight. So I'm not the prime, avatar for that type of therapy. However, what we do generally recommend is performing an extended water fast for people who are either overweight and trying to accelerate their rate of weight loss so that they can improve their overall metabolic profile, people who have the metabolic syndrome, people who are diagnosed with prediabetes or type 2 diabetes, and then also for people who are living with high cholesterol or high blood pressure. Okay, so it's a case-by-case basis for sure, but in general, sure, performing an extended duration water fast, whether it's 2 days, 3 days, 7 days, or beyond, can have incredibly powerful effects at significantly improving your overall base metabolism, no question.
Thank you. Dr. Stoll, how do you pronounce your last name so I say it correctly?
Yeah, Stoll, you're fine.
Thank you.
Yeah.
So we're having a 17-day conference, and a lot of our speakers are very confident and very charismatic, and they have really fantastic credentials. And when they speak, we think we've just heard the final version of truth. And then the next speaker says something different, and it gets confusing. So Dr. McDougall has said that we're supposed to eat starches, beans, grains, potatoes, corn. Let's focus on the vegetables. Joel Furman is saying that nuts are absolutely a significant part of health and that we should make sure to include them. And he has his diet that's very focused on vegetables. Brian Clement is saying it should be a raw food diet and we should exclude fruit because it feeds yeast mold, fungus, candida. Dr. Esselstyn is saying avoid oil at all costs. Dr. Goldhammer is saying no salt. Pam Popper is saying, yeah, no salt and no oil, but also all this stuff about supplements is not evidence-based, and she's not even sure if we need DHA, EPA, and even vitamin D, which everyone else says we do need. So there's a lot of people giving us different whole food plant-based messages, not to mention all the low-carb, keto, paleo authors who are saying don't even eat plant-based. So what would you say to us? How do we interpret this? What's your conclusion after hearing all these different people's approaches?
That is a great question. And, I like to step back from kind of the granular view and just take a look globally. We have a population globally that is continuing to get heavier and sicker. We have more and more chronic disease that is eroding individual health, family health, community health, financial health of hospitals, healthcare systems. We have a massive problem globally because of the westernized diet. There are nuances to many of these diets. There's science behind, the recommendations. Most of the people that you've talked about are good friends of mine. I think in scientific circles, it's wonderful to have these conversations, but there's a very practical aspect of this that I don't want to lose, and that is that most people are not eating any vegetables. The leading nutritional deficit nationally right now is fiber. Only 4% of any age group is getting the minimum requirement of fiber, which is 25 to 35 grams. All the science shows that we start to see disease prevention and reversal at 70 to 100 grams of fiber. And so, we could talk you could have an entire, 2 or 3 day panel on the nuances of vegetables, non-vegetables, SOS-free, salt, oil, sugar-free diets. And there are benefits. And there's, especially when somebody is trying to reverse disease, focusing on some of those things is actually very important. But I think what's important for all of us as a group is to recognize the need around us, which is coming alongside people that are not eating any fruits, any vegetables, that are largely deficient in fiber, that are struggling with disease, that don't know how to cook food, that don't understand how to make plants delicious. Less than 10% of people are even meeting the 3 to 5 servings of fruits or vegetables every day. And so I really like to focus as a clinician on coming alongside the general population and helping them discover fruits, vegetables, beans, lentils, whole grains, spices, herbs that can be incorporated into delicious, easy to cook meals that will begin transforming their health.
Thank you.
Steve, very good question. It was one of the best questions I've ever heard before. And Scott, very good response. Very good. Just want to give you guys both shots out for that.
Thank you. Karla, a lot of us here take it very seriously when one of the speakers says, I'm going to tell you the most important mineral. I'm going to tell you why you need magnesium. I'm going to tell you why you need a probiotic. We write our notes down. We call up to find out how to get the probiotic. Because we think that the supplements and the food and the exercise is everything. However, every now and then someone says, by the way, emotional health is a real thing. And anger and resentment and judgment actually puts chemicals in your body that are bad, just like fried food. Now, a lot of us think that's fluff. And we go back to focusing on what supplement do we take? What food should we take? Can we have, a smoothie? We're very focused on the food. But we're walking around angry and judgmental half the time and blaming and people mad at Trump and mad at Biden. So from a real scientific perspective, is this a cause of disease that we're judging and angry and resentful and blaming? Is this something that we should care about as much or more than our food or exercise and our diet? Or is that just something that sounds good to say?
Well, we know from the research that these 10 healing factors made a difference. These were common among all 1,500 plus of the survivors. And again, they overcame a late stage diagnosis. And we don't know yet which, if any of these, is more important than the other. But we know that of the 10 factors, only 3 of them are physical and the other 7 are emotional and spiritual. We also know from independent studies that are done on stress management, et cetera, how impactful it can be. So there are studies that show how stress affects our immune system and cancer recurrence and long-term survival. And so we can look at those studies, and there's many of them that can help us understand what this does to our bodies. And you're right, it's releasing hormones, releasing stress hormones into our system that's depleting or dampening our immune systems. And when we want to overcome a diagnosis, we need our immune systems to be at tip-top shape, optimum, functioning. And so many of the emotional and even the spiritual things are helping us to rebuild our immune system. In fact, all 10 of the healing factors that Dr. Turner uncovered in her research have separate studies to show why that particular thing increases the immune system. It improves the immune system to help us then get back to a point where our bodies can overcome what's happening to it and can get back to producing the good hormones and dampening or really getting rid of those cancer cells or diseased cells that shouldn't be there. Does that answer your question, Steve?
Yes, thank you.
Of course.
Cyrus, Dr. Stoll, do you want to answer that same question? Do you have any thoughts on it?
Cyrus?
So I haven't actually read the research myself. I think a lot of the times people want to see a randomized control trial, right? That basically says, okay, we can take a look at this population and we can say, these are the things that this population has in common. And these are the factors that led to an improvement, right? That's like observational research, which is very powerful. But then if you really want to put something to the test using the scientific method, you do what's called a randomized control trial, where you say, we're going to take a group of people, we're going to split them into two different groups. We're going to do, intervention A here, intervention B here, and then we're going to test the difference between the two of those, right? So I haven't personally read the research specifically about how to, a randomized control trial on emotional health when it comes to overcoming metabolic disease or cancer. However, I have talked to many natural health professionals who all have done the research themselves, and they have all come to the same conclusion. So I'm going to defer to them, and I really can't really speak about it with any air of authority until I actually do the research myself.
Thank you.
Yeah, and I would just simply add that there's a growing body of research to show that when we're experiencing stress, and stress can be any of those emotions that you mentioned, post-traumatic stress, anger, unforgiveness, bitterness, the body interprets that through the lens of the stress response, which releases noradrenaline and cortisol, which begins disrupting the microbiome and producing inflammation. And so there is, a growing body of research that shows the levels of oxidative stress and inflammation associated with emotional disruption and strong linkages to heart disease, cancer, autoimmune diseases, and a host of other diseases through that stress mechanism.
Thank you. Karla, what do you say to critics who argue that holistic cancer treatments can dangerously delay conventional treatments?
Well, I think from the research, we see that there is something to learn from those people that take an alternative approach. In that first book that Dr. Turner wrote, it was based on people who had either done an alternative approach or had done the conventional approach, which failed them, sent them home on hospice, and then they did their own thing and overcame. So there's something to learn from those people. And I think there is a time and a place for people to act quickly and to utilize conventional medicine. And many diseases, you've got time to think about it and maybe try some other ways before you go to the extreme of chemotherapy and radiation. I'm not against chemotherapy and radiation. My first cancer diagnosis, I went through it myself. With my metastatic diagnosis, I did not need to go through that again, but I believe that there is a place for people to try to heal themselves, to really get themselves on that whole food plant-based diet and get the right exercise and clean up the emotional garbage that might be hanging around in their body and really take care of some other things. Most cancers take some time to grow. So if it's not an aggressive, fast-growing cancer, you probably have some time to be your own little experiment. 3 to 6 months, give it a try. See if you can start to reverse things or get a better result, get things stable, and then make your decision.
Thank you. Cyrus, how do you address critics who argue that a high carbohydrate diet might be maybe detrimental to individuals with diabetes? So even if you're eating a whole food plant-based diet, if you're having lots of beans, lots of sweet potatoes and potatoes, lots of whole grains, doesn't this raise your blood sugar?
Okay, so I'd say it's a very good question. And truth be told, that is the one argument that has persisted since, as far as since the time I was born through now, and I think it may never go away. There's a lot of conflict in the world of diabetes about carbohydrate, right? People refer to them as carbs, and people say carbs are bad for you because carbs contain sugar, and carbs contain sugar. Therefore, they're going to raise your blood sugar, and sugar is bad for you, and sugar is going to make you fat, and it's going to cause your blood sugar to go up. And as a result of that, you're going to end up with diabetes. But if you go backwards and take a look at the actual biology, and you draw out the biochemical pathways on a piece of paper to understand what happens to carbohydrates when you consume them from whole food sources containing a significant amount of fiber, as Dr. Stoll had mentioned earlier, what you'll find is that there is a giant difference between people who eat refined carbohydrates that are low in fiber and people who eat whole carbohydrates that are high in fiber. Okay, so if you literally just took all of carbohydrate biology and you split it down the middle and you said, these are the refined products that come from manufacturing processes, and these are the whole products that come from fruits and vegetables and legumes and whole grains, right there, that would take care of 90% of the conflict, because the whole carbohydrates on the right side are the ones that are actually associated with and actually causational in improving improving health outcomes, whether that's reduced risk for diabetes or heart disease or for certain forms of cancer. Okay. The refined carbohydrates are the ones that can be metabolized very quickly because they come with a very small amount of fiber. They can cause detriment to your liver. They can cause detriment to your insulin signaling pathways inside of your liver and inside of your muscle. And they can cause high blood glucose, high A1C, and metabolic distress. Okay. So we must make that differentiation when we're talking about carbohydrates, period, end of story. So anytime that somebody says, I'm eating a low carb diet, I immediately challenge them and I say, what type of carbohydrate are you talking about? You cannot talk about the word carb unto itself. It has to have a modifier in front of it. It's either whole carbohydrate or refined carbohydrate. And if you can't tell me that, then you're going to get confused. Okay. The second thing that I would say is also that when you consume carbohydrate energy in a high fat environment, it will not work, because if you look at the biology on a piece of paper, what you will find is that fatty acid metabolism and glucose metabolism are two completely separate metabolic systems. It's not just one pathway, it's a collection of pathways on both sides. And the two systems do not play nice with each other. And what I mean by that is if you're eating a diet that contains a significant amount of dietary fat and or cholesterol, you literally activate many of the biochemical pathways that are responsible for digesting and transporting and uptaking and storing and oxidizing all of that energy. Similarly, if you did the opposite thing and you started eating a significant amount of carbohydrate energy, then you're going to upregulate all of the enzymes and the workhorses responsible for digestion, transport, uptake, storage, and oxidation of carbohydrates. The problem is that when you do the two of them at the same time, things can go very weird. When you do the two of them at the same time, that's called the standard American diet. That's when your fat intake is relatively high, your carbohydrate intake is relatively high, and that is a recipe for disaster that can lead to hyperglycemia, which is high glucose, hyperinsulinemia, and it can also lead to hypertriglyceridemia, weight gain, high cholesterol, high blood pressure, and beyond. So the last thing I'll say here is that we need to make the distinction between whole and refined carbohydrate, no questions asked. But secondarily, we also have to do it in a way where if you really want to be able to eat a carbohydrate-rich diet and control your blood glucose with precision, which again, we've seen thousands of times over, and there's plenty of research to demonstrate it, it has to be done in a low-fat environment, period, end of story. That's true for adults. It's true for children. It's true for humans. It's true for all mammals. And so once people recognize that carbohydrates have to be consumed in a generally low-fat environment, then all of a sudden, a lot of the confusion dissipates away and it becomes a much more understandable story.
Thank you. Dr. Stoll, I want to read you something and tell me if you have any thoughts on this. Total knee arthroplasty is the most commonly performed total joint replacement surgery in the United States, with over 600,000 procedures occurring annually. Total hip arthroplasty is the second most common. Both types of surgeries are significant in volume and are expected to increase in the coming years due to factors such as the aging population and the rising prevalence of conditions like osteoarthritis. In light of the increasing prevalence of joint replacements, what proactive measures can be taken to prevent the need for knee or hip replacements? Is this something that you feel that our diet and lifestyle can have any impact on?
Yes, absolutely. And it's similar to when we're talking about diabetes, heart disease, and other cancer and other chronic diseases. We have to say, why is there an epidemic of total knee replacements? And and hip replacements. And again, we can look to our lifestyle as one of the leading causes. We know that additional body weight Every pound of body weight is 3 to 5 additional pounds on a knee or an ankle. And so as people get heavier, they're putting additional shear forces on their joints every single day. We also know that the diet and microbiome that are produced by that diet create inflammatory molecules that digest and destroy cartilage. So the food that we're eating is also contributing to the damage and destruction of our cartilage. We know that old, unhealed, and restored injuries create biomechanical imbalances in the body, just like our car tires. If our car is out of alignment, one of the edges of our tire will wear down. Same thing in the body. If we're not exercising, stretching, trying to maintain some biomechanical alignment, our body can get out of alignment. We're on phones all day, we're on computers, we're sitting, we sit in improper positions, and our bodies get out of alignment. We begin wearing down joints, preferentially in one side versus the other. Some of the traditional musculoskeletal care can damage the cartilage and accelerate degeneration. We know that NSAIDs, which are commonly used, anti-inflammatories, ibuprofen, Motrin, etc., disrupt the gut. They disrupt the microbiome. They can contribute to long-term impaired healing, especially healing of cartilage and ligaments. We know that injections of cortisone into a joint actually damage the chondrocytes that help to repair cartilage. So repeated cortisone injections accelerate the degenerative process of a joint. And just even knee arthroscopy, going in and cleaning up the knee, as the orthopedic surgeons like to say, can also create more instability in the knee. And the research shows that knee arthroscopy accelerates the time to a total knee replacement. So there's a multiple factors, which really go back to the same kind of choices of, eating the right foods, rich in plants, and many of those foods, broccoli, grapes, greens, etc., help to balance and support the chondrocytes to rebuild cartilage in the knee. Exercising in such a way that we're just maintaining movement and flexibility, sitting Indian style, sitting with our crossed legs open, where our hips open up, stretching our thighs and our hamstrings. So we have a nice elongation of our legs, doing downward dog as a stretch to stretch the posterior chain. And trying to look for ways to take care of a problem early rather than late. When we have pain, it's our body telling us that we have a problem. We don't want to put duct tape on the pain, and so we don't take anti-inflammatories to try and cover it up. And so dealing with an issue when it's early, when it's a small problem before it gets to be a big problem, through good therapies, functional fitness, healthy alternatives to cortisone, like platelet-rich plasma, prolotherapy, to help support the body's healing process.
Thank you. Karla, how do you balance optimism with realism when discussing cancer prognosis with your clients? And also, of all the 10 lifestyle changes you suggested, which do you believe has the biggest impact on preventing a cancer recurrence?
Mm-hmm. So balance is definitely important, and I am a born optimist, and so I will always probably lean a little bit more that way. But some people are in dire situations, and it can be hard to find your optimism and to balance, people's expectations, like these 10 healing factors, changing your lifestyle. It's not a guarantee that you're going to overcome this diagnosis. I like to be really honest with people. I like to ask them really hard questions that, if they're ready for it, let's dig in a little bit deeper and figure out, what's going on in your life that might need to change. The thought is that if you're a hospitable host to cancer now, the best way to become an inhospitable host is to change the environment in which it grew. And that's the physical environment, the mental, the emotional, the spiritual environment. And, there are people who, everybody that gets a cancer diagnosis gets scared. They get the anxiety from it, right? The stress of it. And I try to remind people that if I could catch them before they talk to their doctor, I'd say, don't listen to the prognosis. Believe the diagnosis, not the prognosis. And I believe Deepak Chopra is one of the first to say that. But it's so true because nobody knows for sure what the outcome is going to be. Nobody, the most educated guess doesn't mean it's right. And so many people put so much weight on that prognosis from their doctor. I've only got 2 years left to live. I've only got 3 months to live, right? That it can become a self-fulfilling prophecy. I believe we need to have hope and faith and belief in our ability to change the environment in which cancer grew. So balancing that realism and optimism is important. And increasing our positive emotions, like I mentioned before, is a muscle that needs a workout. So it's really important that we try to bring in laughter and joy and happiness every day to balance out the anxiety and stress and fear that we're under. And really looking at, what can you do? What actions can you take that are going to help you? So not just following doctor's orders, unless it's Dr. Stoll, then maybe you would just follow doctor's orders. But, most conventional doctors aren't telling you that there's anything you can do about it. So that's kind of where I've got on that one. And then the other half of your question, I'm sorry, I already forgot it, Steve.
I already marked it in red. Hold on.
You already checked it off.
What lifestyle changes do you believe? Which to prevent reoccurrence? What of the 10 lifestyle changes do you feel is the most powerful?
That's really hard to say. That would just certainly be my personal opinion. And again, we don't know which of any of these factors is more important than the other. I know for myself that a plant-based lifestyle has made a huge difference to how I feel, how I look, just how my cancer has been in remission for 7.5 years. No evidence of disease, actually. But they're all important. I think I wouldn't want to put diet as the only thing. I think the other really important thing for me was slowing down my lifestyle, which I put in the category of deepening my spirituality, because I spend a lot more time sitting and just being, listening to the inner voice, listening to the voice of a higher power. And I think that is a huge part of my healing. And I would never want to give that up.
Thank you.
Mm-hmm.
Cyrus, everything I've been asking you is kind of geared towards people with type 2 or type 1.5 or diabetes or type 2 diabetes. For people that have type 1 diabetes or maybe type 1.5, but specifically type 1, what do you want to say that's different about the approach or the philosophy than the approach towards type 2 diabetes?
Okay, very good question. So people with type 1 diabetes, myself included, generally speaking, are either diagnosed with, it's basically an autoimmune version of diabetes, which means that the beta cells inside of your pancreas have been targeted for destruction by your own immune system. So your immune system is the one that's decreasing beta cell count. And as a result of that, your ability to secrete insulin goes from being what's considered normal to as close to zero as possible. So people who are living with type 1 diabetes end up getting to full insulin dependence, usually about 12 to 18 months after diagnosis. People who are living with type 1.5 diabetes are usually, generally speaking, over the age of 30. They have a weak autoimmune program inside of their body, which also targets beta cells for destruction, but doesn't do it as powerfully as type 1. So you can think of type 1.5 as basically being slow progressing adult onset type 1 diabetes. Okay. Regardless of whether you're in the type 1.5 or the type 1 bucket, the recommendations which I had laid out earlier are all still 100% applicable for those in both of those categories. And what Robbie and I basically did back in the day when we were first developing the Mastering Diabetes method is we thought to ourselves, you know what, there's a lot of confusion. There's a lot of, there's many different types of diabetes, and they're getting more complex over the course of time. And what are the generalities? What are the commonalities between all the different diabetes types? And what we determined, what we learned through experimentation on our own body and also by reading the research, is that insulin resistance is really the uniting factor that unites all forms of diabetes. So like I said earlier, the three pillars are low-fat, plant-based, whole food diet, consistent movement, and intermittent fasting. All three of those still apply to people who are living with insulin-dependent diabetes. Intermittent fasting, again, is an approach that's not 100% applicable to all people. Okay. It generally applies to people who are overweight because it's a simple thing that they can add to their regimen that will help accelerate the rate of weight loss. If you're already at your ideal body weight, you can still perform intermittent fasting, no question. You just got to be a little bit more scientific about it to make sure that you're not going into a calorie deficit. And if you do, then you can end up becoming underweight, which can cause problems down the road with either sarcopenia or osteoporosis. And nobody wants that. So generally speaking, all of these same principles apply. What we have seen is that people who are living with type 1.5 and type 1, you can't reverse it using any of the strategies that I'm suggesting here. Okay. We're not trying to insinuate or trying to directly say that this is a diet type 1 or 1.5 reversal protocol. It is not. And I cannot make that claim, and I will never make that claim. This is just a way to improve your time in range, to decrease your glycemic variability. In other words, get a much more flatline blood glucose. And as a result of that, that unto itself can significantly reduce your risk for many chronic diseases, many ancillary chronic diseases into the future. Many cardiovascular abnormalities can significantly get reduced. And then all of these sort of like inevitable consequences of living with diabetes, like peripheral neuropathy and retinopathy and erectile dysfunction, they tend to fade away into the background as well. So we like to think of glycemic control as one of the more powerful levers that you have at your disposal, regardless of the type of diabetes you're living with, that can help not only improve your diabetes health, but also get you to a point where your risk for overall chronic disease is significantly lowered.
Thank you. Dr. Stoll, what are your thoughts in terms of a whole food, plant-based lifestyle with exercise, of alcohol, and also of people trying to lose weight using the Ozempic and similar drugs?
Those are two great questions. First, alcohol. All of the research now shows that alcohol increases the risk of cancer and is not a health beverage by any stretch. Every single sip of alcohol damages the body, damages the microbiome, injures cells throughout the body, and will never lead to good health. So, 2 alcoholic beverages a week for a woman significantly increases risk of breast cancer and ovarian cancer. Similarly for men. So it is never, ever a health beverage. And I recommend people not consume any type of alcohol. Water is always a wonderful choice. And that's a great place to start. It's interesting with Ozempic, and this is, it's again, I think it just highlights a philosophical difference in our approach to problems in the world. In modern allopathic medicine, we look towards like reducing problems to small, treatable, compartmentalized solutions where we can develop a drug or a medical intervention to tackle it. And that's what we've done with drugs like Ozempic, as you mentioned. They are inhibiting GLP-1. They're inhibiting a signal of hunger so that people just don't eat. And if you don't eat, we know you lose weight. However, your body was designed to eat. It needs more than 90 nutrients on a daily basis to maintain all of the cellular function that Cyrus was talking about. All of the different pathways are maintained by minerals and vitamins, which serve as, as substrates for these enzymatic processes. If we're not getting those nutrients, then our body may be thinner, but it is actually nutrient deficient. It may be inflamed. You can be thin and unhealthy. There are a number of studies that show, and all of us can recount patients that we've seen that are thin, they have cancer, they're thin, they have type 2 diabetes, they're thin, they die of heart disease, thin, they get dementia or neurodegenerative diseases, thin and get autoimmune diseases. So while there is benefit in losing body weight, reducing some of the hormonal challenges that come from being overweight, reducing the inflammatory load that's associated with excess weight on the body, it does not necessarily dictate that you're going to be thin. And with all of these new drugs, give it 5 years and we'll see the long-term implications. There are some new studies that are just coming out with these drugs showing that you actually are losing skeletal muscle during the consumption of these drugs. And when you stop the drugs and regain weight, it's being replaced with fat. So one of the most important tissues in your body for metabolism, for strength, for balance, for fall prevention is being lost through the use of these medications. They're not a long-term solution. People use these medications. They have to transition to something after the medications. If they've not learned about a healthy lifestyle and how to begin integrating that into their life, they go right back into an old unhealthy lifestyle and will, like so many studies with the diet area, large percentage of people will regain the weight they lost. Finally, they're a very expensive solution. And simply going back to the foundations of lifestyle, as we started our conversation at the top of this hour and 15 minutes, the simple foundations are eating a whole food plant-based diet, moving more, getting a good night's sleep, learning to release stress and emotional burdens, being connected in a loving community. We can begin to integrate people into those solutions as the most cost-effective, highest impact intervention that we can ever create as a society.
Thank you. Yes, sir.
Can I just add one thing about Ozempic?
Yes.
Okay. So Scott is absolutely right in the sense that Ozempic is basically causes an interference of the GLP-1 pathway, which effectively disrupts your brain from recognizing hunger signals properly. And so what Ozempic does is it talks directly to your hypothalamus and basically says, you are not hungry. And then it also talks to stretch receptors inside of your small intestine and says, hey, there's something inside of you, which then is relayed up to your brain that says you are not hungry. And as a result of that, people who are using Ozempic no longer experience as much hunger, and they basically go into a negative calorie balance. So the benefit is that you can lose significant amount of weight in a short period of time. A New England Journal of Medicine study demonstrated that after 68 weeks, which is just over a year, that people who were treated with Ozempic ended up losing 15% of their starting body weight versus the placebo controls who only lost 2.5%. So as soon as that study came out, people were like, wow, what a powerful weight loss drug. And just like Scott was saying, it's now become this sort of like get skinny, quick therapy. That's what people are doing. And so like, it kind of highlights the idea here that why do I need to try so hard at changing my lifestyle? Why do I have to improve my emotional health, like Karla's saying? Why do I have to start moving my body more, like Scott's saying? Why do I have to sleep more? Why do I have to change my diet? That seems exhausting. Why don't I just go to the doctor, get this injection, and then I can do it? And now all of a sudden I can do whatever I want. I can eat whatever I want. And the weight's just going to come right off of me. Right. So it sort of taps into a certain part of the human brain, the human psyche that says, this is easy. Why don't you just do this instead? And unfortunately, the medical establishment is so quick to use this as their get out of obesity for free, get out of obesity easily card. And as a result of that, there's millions of people who are using Ozempic and other GLP-1 receptor agonists that don't need to be. That's the problem, right? They can do it using lifestyle, like all of us are saying. Every single health expert in this conference will probably come to the same conclusion that if you just change your lifestyle, you can significantly improve your health. But yet the easy way to do it is just to take this injection and all of a sudden your problems go away.
Thank you. If you could each make a final 30-second closing remark and how we could stay in touch with you and follow up with your work. Karla?
Okay. Well, thank you, Steve, for this opportunity and for everyone, your time and attention here. And believing that lifestyle change makes a difference is a good place to start. And I hope that you will all consider making the appropriate lifestyle changes and not trying to find the easy pill. You can connect with Radical Remission Project at radicalremission.com. We have our podcast at Radical Remission Project, Stories That Heal, on all the podcast channels. And on the website, you'll find where you can attend a workshop or work with a coach one-on-one. So hope to hear from some of you.
So people can call up and get coaching directly with you?
Yes, they can. We have 150-ish coaches around the world to coach people on radical remission healing factors, and some have different credentials to go with that, and maybe a practitioner or doing other things to help you. But you can find a coach to help you. You can find me there, and you can find workshops and other events.
Thank you very much.
Thank you, Steve.
Cyrus, your final thoughts, and how do we stay in touch with you?
Okay, great. By the way, thank you for putting this together, Steve. Really appreciate it.
Sure.
Final thoughts are that you have the power at your disposal. If you choose to modify your lifestyle the way that all the health experts here are explaining, so many positive things can happen to your physical health, to your emotional health, and to your mental health. It is an all-in-one, very powerful solution. There is nothing else on the planet that I've ever seen that can significantly improve your health as much as lifestyle change, period, end of story. So if you choose to listen to the advice being given here and in other talks, it is the gift that keeps on giving. So try and get out of if you're having a difficult time starting the process, just try and get out of analysis paralysis and just go. And once you start to do it, I think you're going to see a lot of positive change that's only going to get better and compound over the course of time. If you want to learn more, you can go to masteringdiabetes.org. And we have a coaching program as well. We have a book, we have a podcast, we have a YouTube channel, we have everything. So just start there. And if there's anything that we can do to help you out, just let us know. And
do you do personal coaching or?
So we have a team of 16 coaches that coach everything from insulin dependent type 1 to type 1.5 to prediabetes to type 2 diabetes. It's a personalized coaching program. We do it in either one-on-one private coaching or in small groups. And the transformations are absolutely incredible. So if you would like your hand held and you want a best friend and a community of people that are going through this process with you, just go to masteringdiabetes.org and you can learn more about the coaching program and sign up for an opportunity to be part of it.
Thank you. Dr. Stoll?
Yeah, I would just end with, after doing this for a very long time, I've come to believe that relationships are the secret sauce. Relationship with yourself, as Karla was saying, is essential. Being kind, forgiving yourself, not removing guilt in the process, and making it a fun journey towards an exciting future. Relationships with others and connecting into a very powerful community is also essential and has untold benefits. And so I just want to encourage people to be kind to yourself, have a good relationship with yourself, and connect with others. You can learn more about our work in healthcare, working with healthcare providers, and you can share this with your healthcare provider to help them learn more about the science, the evidence of whole food plant-based nutrition and lifestyle and preventing, suspending, and reversing disease through the Plant Nutrition Project, plantnutritionproject.org. We have a directory called Plant Nutrition Providers of healthcare providers around the world that will utilize a plant-based diet and lifestyle as a primary foundation for treating disease. We have a Plant Nutrition University, which is designed for every healthcare professional student, from health coaches to doctors and dentists and physical therapists. It's a free platform to deliver the science to you with new courses every month. And it's also for faculty. So share that with any students or faculty members that you know. And a lot of other amazing resources, quick start guides that are free on plantnutritionproject.org. So welcome, join with us in this opportunity to help transform healthcare. So thank you, Stephen. It's been an honor being here.
Thank you. Could we unmute everyone so everyone could say thank you?
Thank you, guys.
Thank you, guys. You guys are awesome.
So much.
Thank you. Thank you.